the gold standard. If I wanted to do a full mouth rehabilitation on myself, right? Would I go to that friend that is a very good dentist, very ethical, but runs 5 offices, very successful and makes a lot of money? Or would I want to go to my other friend? They're both great friends, both great dentists, but the other friend that decided to stay on a certain size that allows him to take care of the details to the highest level possible.
Today, we're going to be talking about, is quality scalable in dentistry with Dr. Tal Morr. Yes, we finally got him. So, Christian, I would love for you to do the honors and introduce our awesome guest today.
Hopefully, most of the people already heard about Tal. Tal is one of the, in my humble opinion, one of the best clinicians I know in North America for sure. A speaker, gives lectures all over. Used to have an amazing technician around 15 years ago. That was me. Just kidding. Yes, I had the honor to work with Tal when I was still a ceramist. We did work together for a few years. It was amazing. He's on my top 3 list of best prosthodontists in the world. But also, he has a very specific style of practice. And this is why we decided to pick this topic when inviting him, is quality in dentistry scalable? Because I believe that this is a question that I've been asking myself, you know, when I started with DSD, when I started to develop ideas that would probably help DSOs, would probably help people to expand. And many people did expand their businesses through the DSD ideas. And I always challenged myself and questioned myself about what is this line between quality and expansion, how far you can go growing and keeping that original super high quality. And I think Tal is a perfect person to talk about this, because even though he does dentistry for many, many years, he's older than he looks like. He kept his strategy very, very solid, and his quality is still absolutely the same. So I want to talk to him about all of these topics and the dilemma between growing and staying where we are in terms of size and quality. So Tal, first of all, thank you so much for being here.
Pleasure.
And yeah, always great to talk to you. And your initial thoughts about this dilemma, this question that I'm placing here.
You know, I think that as a dentist, a young dentist, I think the first decision you have to make is, what is your ultimate objective? Because there's really no right or wrong. There are 2 paths you can take. There's the path of trying to achieve the highest quality, or there's a path of just practicing, building the quantity of patients that you have, relaying a nice average dental scope in your practice and making your patients happy. Ultimately, you have to make that decision, because what I've always told the people, that are the young people that I speak to, I said, if your objective is to build your name and build yourself as one of the top clinicians, everything you do is a reflection of you. Meaning, when I started, every filling of mine was perfect. Every crown of mine was expensive and done perfectly. And I remember when I first started, I worked for a guy and he said to me, "You're freaking crazy." I said, "Why do you say that?" He says, "You spend way too much time on the patient. You spend way too much money on the technician. You're too picky." But what happened was, everything that I did became represented in my community. How? Because my patients went to see other specialists, they went to see other dentists, they saw my work, they said, "Wow, who did this? Who did this? Who did this?" And I built my reputation that way. If you start on the average or below average route, which is, there's no right or wrong, you will not differentiate yourself from anybody else. I also never use a laboratory technician, a local one. I sent away so that I would be different than everybody else, because ultimately, if I do the best preps, the best temps, the patient's going to see, and everybody else is going to see the final work, the laboratory work, versus somebody else that butchered the teeth, but they have the same lab. It's the same thing. So
So
you have to differentiate yourself.
yeah. So at the end of the day, it did pay off financially. You run a successful practice,
Right.
and you have a great lifestyle because you are a great dentist. But I see.
But
From
there are issues with it.
yes, that
Right.
so it's not easy emotionally and physically to do this level of dentistry for so many years. It's a hard decision, right? And we are not here to judge the dentist that decided to go more
Absolutely
business
not.
oriented, right?
Absolutely not.
But I see the difference. I know all kinds of dentists. I know, two ethical dentists wanting to do the best. One is completely focused on the clinical quality, and the other is more focused towards the business. And
Right.
you can see the difference on their decisions. And I was always, and it's nice to see the ones that are business driven, they usually make more money, they usually make more money, and they find ways to multiply themselves and to scale a little bit, even with quality, So you see people that were able to find a formula to expand, to open 2-3 locations, to hire more associates, a nice formula, a nice ethical formula of doing good dentistry and scaling and making more money. But the question here is, and this is a question that I started to ask myself. I understand, it's an option. You can go for super boutique, you can go for bigger, whatever. My question was, what is the gold standard? If I wanted to do a full mouth rehabilitation on myself, right? Would I go to that friend that is a very good dentist, very ethical, but runs 5 offices, very successful and makes a lot of money? Or would I want to go to my other friend? They're both great friends, both great dentists, but the other friend that decided to stay on a certain size that allows him to take care of the details to the highest level possible.
And of the patient, to take care of the patient instead of running from room to room, focusing and doing and giving everything we have to our patients.
A more customized relationship.
Yes, exactly.
So you have, so I saw these 2 models.
Yeah. What did you choose?
And of course, for me, if I'm going to do a full mouth rehabilitation on me, I know who I'm going to choose. I'm going to choose the one that decided to make a little bit less money, but focused on every single detail, every single experience, every single aspect of quality, right? My question here is, if you have these 2 sides, there's a line in between, and you can maybe grow the volume of patients. You maybe can go from 2 chairs to 3 chairs, maybe 4 chairs. You can even maybe have one super good associate that you're training and doing some steps for you. But where do you think is this line when, if you grow a little bit more, you start to drop quality?
So that's a very good question. But before I even talk about that, I want to talk about, there's 2 ways to grow. Right? One is to see more people, have more dentists, and just do volume.
Yep.
And the other is to increase your pricing.
Yes.
How do you get
that has a ceiling? That has a ceiling.
It has a ceiling, but how do you get to the point where you can increase your pricing? It's based on building your reputation as one of the top people. Okay. Okay. But you're absolutely right. It has a ceiling. So it all comes down.
You probably hit that ceiling. When did you hit?
I'm still raising my fees. I raise them all the time. Okay.
But beyond normal.
I'm beyond normal.
No, beyond you're literally becoming more expensive as your reputation is growing.
Yes, but it's for 2 reasons. One is to obviously be compensated for the effort and experience and time I invest. And the second is to limit. I'm not, a Lamborghini is not for everybody, right?
Yeah.
Okay. So I'm not for everybody. And I tell patients, they say, wow, you're so expensive. And I said, you know what? I'm not for everybody. But if you want me to give you my heart and my soul, which I do for every patient, that's what it's going to cost you. And it's giving you my experience as well. Now, where is the fine line? I believe that there's different personalities in dentistry. For me, I'm a control freak. Okay. If I expand too much, I have an associate, by the way, that I'm trying to control the situation, and I can't, even with one associate. I just can't control it. So that, in a sense, is stress for me, and I don't need more stress in my life. I have enough stress. As you expand, as you grow, as you bring in more people, there's much higher stress. There's less control. There's it's just another animal, which I don't even, that's why for me, that's not even an option for me. I don't want to do that. Now, what is the negative of that? That my practice is built on me. And we've talked about this before. And my practice is me. People come here for me. I haven't, what I should have done, a huge mistake that I made was in the beginning, I should have brought someone with me. I should have had associates. I should have trained them. So we would grow together as a unit. Then you can multiply. See, if
But
I would,
it will drop because.
but if I have the ability to train them for years, I believe that I could, it will drop to a certain degree because they're not me, but they may be even better than me. Who knows? I believe that you're, and we talked about this too, that you're either going to be able to do it or you're not to a certain level. But I believe that I should have, when I think back, what I should have done is develop associates with me throughout this whole process.
But I think that you mastered your model and you're taking it to the highest level possible. I don't.
But I have a ceiling, as you said.
Yeah, but you know, that was the choice that you made, and I think it was a brave choice and a beautiful choice of sticking with the highest quality possible, right?
Yeah.
No compromises, no compromises. Every single decision is towards the highest possible quality, period, right?
100%.
And we know that that's not necessarily the best business model.
It's not.
That's what it is, right? That's what it is. So let's give just to give a little bit of perspective on this. Let's do a little X-ray on your practice, on your model. So, how many dental chairs you have?
I have 4 dental chairs.
4 dental chairs. Dentist, you said is you and one more associate, right? How many assistants?
I have 3 assistants.
3 assistants, and they rotate with you and with the other associate.
Yes, and I have 1 hygienist. I have 2 hygienists, but one day each one.
So 3 assistants and 2 hygienists, or.
But my hygiene isn't like a general dental practice because my volume is lower than a general dental.
So they come a few days, and then you have what? 1 more front desk, 1 manager, 1 treatment coordinator. No.
I have 1 front desk, and I have my wife who does the bills. That's it.
It's the model, as lean as it can be.
It's lean.
And I can tell you, if whatever you grow beyond this in terms of size and volume, revenue, will probably have an impact on the quality, right?
I'm sure it would.
And this is the thinking process that I've been having with myself since 5, 6, 7 years. As I've been teaching dentists on how to grow, on how to multiply, on how to scale, on how to delegate, and that's why I started this discussion with myself on, but if I would had to pick a dentist to go and do a full mouth rehabilitation myself, where would I go, right?
But think about this, Christian. It not only has an effect on the clinical level, but it has an effect on the customer service. Can you imagine that my patients, they know everybody in the office, they know my front desk, they have incredible relationships with my practice. They're like a family. I know you know the story, but I actually went to another practice to try it out because my friends have this very successful big practice with 20 people working there. And I lasted 6 months. And every one of my patients told me, why would you even think about changing your style of practice? We love your office. We love the family ambiance. We love the connections that we have. We like this business model. Let's put it that way. It was more of a business practice. And I realized myself within 2 weeks in my gut, I said, this is not for me. Okay. So So I don't really have the answer because I did exactly what I wanted to do. I had a vision. I've achieved my goal. And I enjoy my small practice, my boutique practice of high-level patients. And the only way, again, the only way I'm capped out unless I raise my fees. That's it. So that's the only way I can grow.
Yeah, yeah. And no, I'm glad there are people out there still doing this type of dentistry, because this is what gives us the gold standard of what can be the ideal dentistry out there, right? And everything is trying to aim towards that direction. Now, from the procedures that you do, so if a new patient comes, what are the things that you believe you can delegate, and what are the things that you want to do it yourself? Because I called it, your type of practice, a 3-star Michelin. It's a very, very good comparison with restaurants, right? The 3-star Michelin, you cannot grow. It's impossible to control the quality. It depends on the chef, on the superstar chef. And the superstar chef will maybe try to make more money opening a franchise with a different name, etc. But that Michelin only gets the 3-star because that chef is in charge every single day, doing over and over again, and making sure that the quality is exactly the same every day, right? The customer support is 10 times better. You feel special from minute 1 all the way to the end. So your type of practice for me is the 3-star Michelin dental practice, right? What are the things that you believe are key for you to continue to do to keep this quality? And what are the things that you believe you could delegate to an associate?
It's a very good question. You know,
initial interview, you do all of them.
Of course.
Clinical examination.
Here's the main issue. Okay. It gets to a point where I'm working now more than I've ever worked before. Okay. I have to work Fridays because I have nowhere to put people. I'm booked out for 3 months. So it gets to the point where I cannot even accept all new patients. So my associate benefits from that because she can see the new patients. But I am involved in the initial evaluation of the patient. I introduce myself.
Even on the cases that she's doing.
Yes, I examine the patient after she comes and tells me what's going on, to help guide her and help to explain in detail to the patient what the findings are, because
and you help with the diagnostics and the planning of the case.
Of course. Yeah. But you know that I've also have 30 years experience talking to patients, and that's something that takes years to develop.
Yeah.
That's key. So I mean, as far as delegating, I mean, my girls do all the the impressions, digital CBCTs, intraoral scans, all the information that I need.
Impression of preps.
Oh, I take that. I take that. I
provisionals.
I do the provisional.
One by one.
The provisional is key. If you want to achieve a certain level, you have to control all the variables.
Because of your reputation, of course, you're attracting more and more people that need full mouth rehabilitations, right? People don't come for a cleaning. People don't come for a single crown.
Some do. I wish more did, but I can tell you that, unfortunately, I've developed a practice which is based on full mouth rehabilitation and problem cases that no one else can manage.
So that's also tough emotionally and physically.
Very, very tough emotionally and physically.
Because even if you follow everything by the book, we know, for me, prosthodontics is by far the most stressful specialty in dentistry, by far. If you had chosen orthodontics or just doing surgeries and implants, I see the level of headache and the level of unexpected problems is much smaller. Prosthodontics, even the best dentists, best technicians, so many things can still go wrong.
Listen, I have a whole day lecture. It's called Shit Happens in Dentistry. Okay? Because that's the reality. Every day you have to deal with something else and you have to figure out a way out. And we do. That's what we do. but you still have to be able to diagnose into treatment plan.
Yeah.
If you can't do that, you'll never achieve the highest level.
So it's almost like saying that, and dental students should know that beforehand, right? To choose prosthodontics, to choose restorative dentistry, and to take it to the next level and to make it very well. It's almost like you need to be already a certain profile of personality
100%.
with a certain skill set of artistic skills and hand skills. You need to have that even before entering dental school. You know, some people, because what the disasters that we see in restorative dentistry are much bigger than in the other specialties, in my opinion.
Listen, just because you're a prosthodontist doesn't mean you have those skill levels. So
No.
I treat a lot of horrible cases done by even prosthodontists.
No.
I agree with you 100%. You need to have that mindset and the skill set before
The package.
Before you even think about it, because it's really, really hard. It's grueling. It's draining mentally and physically. I used to think, would I have chosen something else? The answer is yes and no. Okay.
Yeah.
Yes, because I know what it's like to do what I do, but no, because I really love what I do. Good at it. So it's kind of a psychological issue that I have, I believe. You have to be a certain personality.
You like to suffer.
You have to have a certain personality to do what we do. And that's it.
No, you are definitely born for this. You were born for it. And you know, somebody has to take that job, right? Somebody has to do it, right? But you know, the comparison, you know, sometimes I remember as a dental technician, because when I say that prosthodontics is the worst specialty in dentistry, I include the technician. So the work of the prosto and the work of the technician, it's really insanely difficult, right? The lifestyle is complicated. You know, the number of nights that I spent in the lab fixing problems that I didn't expect at all, you know, the back and forth, and the fact that you need to deal with a completely different level of emotions from the patient, right? It's different than doing a surgery, placing an implant, also integrated, cool, go to the prosthodontist, right? You do the orthodontics. Oh, everything is aligned. You have occlusion, class 1, fantastic. Now go to restore your teeth.
Surgery is by far the best specialty there is. You see the patient, they pay you a lot of money, you do your procedure, and they say goodbye. Occasionally you have a problem here and there, but everything heals, right?
Yeah. And it's not the final procedure that is going to dictate the way they're going to face the society, right?
Right. Who is the final ultimate responsible person?
If I cannot smile to my friends, is your fault, not the surgeon's fault.
Your fault. And you know, part of my lecture, this shit happens lecture, I thought about this for years. You know, I used to get so pissed that they would send me these crazy cases that I had to do miracles. And then I realized the reality is we actually have the most control of anybody, right? Because they have a biologic limitation and they have a biologic impact of everything they do. You understand what I mean? Or I'm talking orthodontics as well. I mean, post-op recession, losing of teeth, external root resorption, internal root resorption, all these things, but ultimately it comes to us. And I used to get upset of seeing these disasters and trying to fix them, but ultimately, really, it's our responsibility. That's the reality.
But why? I always ask myself why surgeons can charge more for their surgeries than.
That makes no sense. Absolutely no sense.
That makes no sense.
Absolutely not. Absolutely not.
It makes
absolutely no sense.
The accountability, you know, the relationship with the prosthodontist, or even a super restorative GP, right, that it's facing the same similar challenges. You have to play the quarterback. You see the patient coming to you, you refer to the specialists. You need to manage emotionally the patient on the way there and on the way back afterwards. And whatever didn't go ideal with ortho and perio, you need to overcome magical optical illusion solutions and playing with the ceramist. And then at the end of the day, if it's not exactly what the patient wants, the patient internally, emotionally, will have a good feeling about the surgeon, will have a good feeling about the orthodontist, and a bad feeling about the prosthodontist.
Crazy. It is crazy. You're 100% right, though.
So have you ever thought about bringing on board a surgeon and a orthodontist so you could capitalize on the whole process?
So I actually do a
Because
lot of.
you mentioned that the only way you can grow financially is raising your fees, right? The other way is increasing your average ticket price, right?
Yes. So because I was sending so much out, because I was losing control, I started doing my own surgeries probably 15 years ago. So now I have full control. I
So
charge.
you do all your various, you do your implants and your grafts.
Correct. Everything. I do everything except for very complex cases that I don't want to be involved in. I send out. I have good relationships with my surgeons. They sometimes even do large sinus lifts for me, and I place the implants because we have an understanding of what we're capable of doing, and I can control the whole case much better that way. And financially, it's much more lucrative because it doesn't make any sense. A surgery to place an implant takes 10 minutes. It costs $23.50 for an implant in my area. Some people charge $2,500. How much can you charge for an implant crown? The lab charges you $1,000. I mean, it doesn't make any sense. So I started doing it myself.
Yep.
Orthodontically, very difficult to control. Very difficult because orthodontists, they get crazy busy. Patients get tired. It never goes to fruition. What you're envisioning, very difficult to control. I don't have one in my office because I use the best people out there. And even then, I have to guide them throughout the whole treatment. So it's a huge responsibility.
It is the quarterback.
Yes. 100%.
And the quarterback usually on the NFL, they make more money than everybody else.
Yes. It's not the orthodontists and surgeons make more than me, but it's okay.
I know. That's what I'm saying.
It's all good for me. I don't care. It was never about the money for me.
No, just question, playing the devil's advocate.
I get it. I get it.
Now, how many new patients do you see per month? Average.
It varies. I would say maybe 15 to 20 patients.
15 to 20 patients. Yeah, there's a lot
of rehabs.
Yes, that's what 15 to 20.
You have no idea how many I have going right now.
And 2/3 of them are full mouth, right? Or big or complex rehabilitation.
Yes. And you know what another limitation that I have? Laboratory support. I have 6 technicians that cannot keep up with my work, that I don't know where to send my work at that level. Can you imagine?
Yeah, I can.
It's very frustrating for me.
Yeah. So several bottlenecks, but let's say you said 15 to 20 patients, right?
Yeah, but I have stuff going on already.
Yeah. So that, look, 15 to 20, let's just guess that 10 of them are very complex big cases. And these complex big cases usually stay with you at least for 3 months, 4 months.
What do you mean?
Of treatment.
What do you mean?
Treatment.
Oh, it's longer than 3 months. Longer than 3 months. My cases take anywhere, simple case, 6 months to 3 years.
So imagine this, 6 months, 15. That means that in every given month, you are managing 6 times 16, 16, 90 complex cases per month are at one certain point of the treatment.
Approximately, yes. Yes.
So it's good that you didn't go crazy yet. You're still kind of okay.
Yeah, I'm trying to manage. I'm trying to balance. Yeah, but it's hard. It's hard to manage. The main issues are 1, laboratory support, 2, space to put these people in. Why? Because I need very long appointments. Right? I can't stick them in for an hour. I have to do a full upper preparation, provisionalization, 4 hours. So I'm finding problems. Scheduling, finding the space for them. They're getting angry because they have to wait 2-3 months to get it. I'm finding problems with the laboratory, finding someone that can keep up with the work that I have. So now I'm trying to figure out how I go to the next level and still maintain that quality.
Good luck with that. Let me make you feel a little bit worse now. We're talking about every given month, you have around 100 complex full mouth rehabilitations to manage. Some are starting, some are ending, but in average, 100 people coming, to you somehow, or even if they don't come that month, you're managing the process, right? Now, in average, let's just guess that you have 10 to 20 preps per case. So that means that you are managing 1,500 prepped teeth per month, that anything can go wrong, a provisional can break, a margin can have an issue, the soft tissue integration and the outcome of the orthodontics and the implant abutment, it's insane. And that's why I appreciate so much, when you see people working at your level consistently for so many years.
Listen, I never said it was easy. And but I have to say I'm blessed because I've achieved what I wanted to achieve. But again, I'm limited. I'm only one person. Sometimes patients forget that. Yeah. And it's difficult to manage, but I don't think I'd do it any other way. I don't think my personality would allow that.
No, I know you well.
I know you.
That's the only way. And you did pretty well.
Yeah, you have to be. Listen, we have to be a little twisted to do what we do. Have to be.
But that's the art. You need to, as young as possible, you need to identify who you are and what you can do the best, And you started the conversation saying something like, when you start as a young dentist, you need to define what you want to become, right? It's like in dentistry, when you start with the diagnostic wax up, you start with the end in mind, and then you reverse engineer the treatment plan. 100%. With the career is the same. You need to, as young as possible, to identify your strengths, identify where you can differentiate yourself, and build a model that will leverage the best side of yourself, right?
Right. But understanding that all the different avenues, although they're different, they're all equal, meaning there's no right or wrong, there's no correct path. It's ultimately what you define as your ultimate goal. And everybody has a different ultimate goal. I had a crazy ultimate goal. Some people say, you know what, I want to make a fortune and I'm going to have 30 practices. That's my goal. That's fine. If that's your goal, you direct your path that way. But you have to realize that what your path is from the beginning. And that's
but I can tell you that if one day I do need a full mouth in US, I would for sure be choosing you to do it.
Appreciate it.
And
I'll charge you a lot of money for that.
Yeah, man. and I'm gonna pretend very well that I'm gonna pay you. I'm gonna pretend very well.
No problem. You don't need a rehab. You never will. That's a good thing for both of us.
Fantastic, my friend.
Yeah.
So I think it's very clear, for me, it's very clear that what you have there is the gold standard for me in terms of dentistry. The number of chairs, the number of people, you can't get better than that. I have other few friends, top dentists around the world that kept that same thing, same model. So, you probably get a lot of dentists that wants to do their work with you.
Yeah, I get dentists too, yes.
Because that's the thing, when you are a dentist, you don't want nobody to touch your teeth. Yes. Right? Nobody, because you know exactly how wrong.
The dentists are the worst patients.
Yeah.
They drive me nuts.
And that's the problem of being very good and very particular about details, that dentists will appreciate that and choose you.
It's all good. I'm happy. I can't complain. I'm very happy with my life.
But anyway, for everybody listening, if you never had a chance to watch Tal's lectures, please try to do it and you will understand exactly what I'm talking about. Hopefully in between many beautiful cases, maybe he can even show one of the old ones that we did together. Yeah. I think that the conversation today for me, the importance here is to really understand the balance between financial growth and clinical quality. This is always a dilemma that is only growing in dentistry. And we need to ask ourselves every single day and make sure that we always remember why we choose this profession. And, the pursuit of excellence is beautiful, even if you're not the richest dentist in town. you still can have a great life and be very proud. So I think you should be very proud of the work that you do, Tal, and your final message to everybody here.
Live your dream, whatever it is, you know, define it early and follow your path. There's no right or wrong. I've never judged anybody
Yep.
choosing their path, and everybody has a different goal.
Mm-hmm.
All good. That's my advice.
And I'm going to finish with my statement that I started this conversation. In my humble opinion, and again, I don't judge as well, but in my humble opinion, quality in dentistry is not scalable. And every time you grow a little bit, you end up always compromising that gold standard, at least a little bit.
I agree with that.
Fantastic, my friend.
Oh,
Hope to
my
see you
friend,
soon.
good to talk to you.
Always a pleasure.
Take care.
Bye-bye.